I'm Dr. Paula Rauch, and I'm the director of the Marjorie E. Korf Parenting at a Challenging Time program. The Marjorie E. Korf Parenting at a Challenging Time program is a parent guidance program. It's a unique program that we offer here at the Mass General Hospital Cancer Center. We provide psychoeducation to parents about how to support the needs and resilience of their children through the parents' cancer diagnosis, their treatment, and survivorship. We have a wonderful team of clinicians that collaborate together and work with families. We are child psychiatrists, child psychologists, and a social worker, each of us trained in child development and experienced with the common challenges that parents face when they're trying to parent well in the context of a cancer diagnosis and treatment. We meet with parents at whatever time makes sense from a parent's perspective, so it's not uncommon for us to get involved with families along with a new diagnosis. We may also first meet a family at the time of a transition in care or recurrence, and sometimes we are meeting a family for the first time at the end of life for those for whom things don't go how we hope. We want to be available when parents want to collaborate with us, but we always hope that clinicians and parents will involve us in their care early in the treatment, because we think that we can be most helpful once we have an ongoing relationship with parents and learn about their children from them. Our goal when we're meeting with parents is to learn from them, because they're the experts on their own children. What we bring is an understanding of child mental health and child development, and that helps us to think together about what's an individualized coping plan for each child and for a family to help keep children on track during the course of the parent's care. The kinds of things that we end up talking about in our visits with parents, our meetings with parents, include what are the best ways to explain cancer to a child. For example, how would you talk about what cancer is to a 5-year-old or a 6-year-old? We'll often talk about what the treatment is and what symptoms of treatment are. We'll think together with parents who may have particular worries about one of their children because of a past experience or because of a challenge that child has, a developmental disorder, a learning challenge. And we'll try to think about not just what does it mean to communicate or what does it mean to be honest, but what might be the words to use. So we want to be sure that parents feel prepared to have the important conversations with their children. Our program is really committed to being timely and accessible, so that the first contact that we have with someone usually follows shortly after we get the referral. We try to be able Monday through Friday to talk with people the same day that a referral comes in, or at least within 24 hours. We're fortunate to be able to be an ongoing resource for parents in their parenting. So they can call us when they feel that they would like to connect with us and have a particular question. It doesn't have to be the same time every week, and it doesn't have to be the same length of a session. The primary focus of our work is with parents. So we typically will meet with a parent who has cancer, or the parent who isn't living with the cancer, and whoever is co-parenting with them. Or sometimes a parent will come in with a best friend to talk with us. It really is determined by who is in that important role with the child. Primarily we meet with parents or other caregivers, but time to time we will end up meeting with children and teenagers. And the reason that we meet with them is because together with a parent, we recognize that the parent will feel more confident in our guidance if they know that we've actually seen and spoken with their child. And then we may together sometimes determine that a child needs more services, therapy of their own, sometimes because we've met with them, and oftentimes because in a conversation with the parent we recognize that that is the case. And then we don't do ongoing therapy with children or teenagers, but what we can do is to help a parent to find appropriate resources in their community. The parents that meet with us do not need insurance, they don't need a referral. We're fortunate to be supported by philanthropy and the Cancer Center so that we're able to see families free of charge. If you would like to meet with one of our clinicians, please call our referral line at 617-724-7272 or ask any member of your medical team to call a referral on your behalf. If you'd like to learn more about our program or about parenting with cancer and how children at different phases of development face the challenges of an illness in the family, please go to our website at www.mghpact.org.